I'm happy to be here this afternoon witnessing the first National Spinal Cord Conference, where we are now cutting the cake for celebrating this immense and very magnitude wonderful day.
2, 3.
Any institution that is taking care of spinal cord injured patients must have an ICU, intensive care unit. It is compulsory, because most of these patients, especially they suffer cervical spine injury at any level, but mostly at the upper level of cervical spine injury. The patient sustains them, they must be under mechanical ventilator.
Having spinal cord injury does not take you away, it doesn't take your cognitive ability. It is a life-changing experience, but not a life-limiting experience.
Accessible communication is also very important. Workplace, in schools, in private places, we should have accessible communication.
The importance of ICTs to spinal cord injury survivors is as important as some part of our bodies, because technology makes things easy, but for spinal cord injury survivors usually make things possible.
So for spinal cord injury, we need a lot of help, and the awareness should be created, even to our family.
With the cervical injury, who's having difficulty with breathing, if somebody is on a ventilator, the life expectancy unfortunately is much shorter than somebody who's got a lower level of injury, for example a paraplegia or an incomplete injury where they're able to self-ventilate and look after themselves better.
We must create inclusive health, education and economic systems. We should plan for people with disability in our health centers, in our schools, and we must empower them also separately to be independent and to make ends meet. We need to establish disability inclusive climate action funds, such that when we are generating funds for climate action, we must understand critical elements that include people with disability.
Stem cell line. What we call the stem cell, these are cells in which they can convert to any part of our body. And these cells have been used in regenerating organs. And in experimental animals, it has been proven to cause regeneration of the spinal cord. And now there are many centers in which they are using the regeneration.
So that people that sustain spinal cord injuries, they will have access to funds to manage themselves. We need the support of everybody. This fund will provide critical financial resources to support immediate medical care, long-term rehabilitation, and the acquisition of assistive devices, easing the burdens that SCI patients and their families face daily.
This is not a document that will teach medical professionals their job, no. But it is the document that will guide policy makers and implementers on what to put in place to address, for example, early intervention. This policy that we are about to make here is one of the tools, strategic tools, that the Commission is going to use to implement the Disability Act. It is this kind of policy that you are about to develop that will help us to break down to the specifics what the Commission needs to do.
This is the communique issued at the end of the first National Spinal Cord Injuries Conference in Nigeria, held on Wednesday 31st July and Thursday 1st August 2024 at exclusive Serene Hotel, Abuja. The theme of the conference is the place of persons with spinal cord injuries in disability and inclusive development in Nigeria.
We want to appreciate everyone that is here. Just like our boss, Dr. Amina, have said, we appreciate you for your time and otherwise.